MCPS and even for the students of the post graduation. And the topic is once again the community as a medicine. And this is 12th October, and you can have your comments, views, because we are uploading this on my YouTube channel, as well as you can have this on the Facebook or any other social media. So this is very important. We are social beings. Social means having thoughts, feelings, and certain ideals and certain futurist looks or futurist goals are also. And our connections are crucial for well-being. And well-being is a bigger term for health. And WHO is also using the definition. Health is not merely a state of mental, physical, social well-being, but it is a kind of well-being. Next. So these are connections. You can see the picture. You can see the picture here. Any problem, if people are around that problem, it will reduce and ultimately it will be solved. The entire science is nothing but the efforts of different people. They work and share their experiences. Ultimately, we had this developed medicines, developed surgical procedures, even developed public health and developed university, including virtual university, which is online university, because sometimes you are not traveling to Islamabad, but you are learning in Hyderabad, while knowledge base is in Islamabad. That can be transferred. The same is true. And here the community, if any place, you will have a kind of community approach, and you will have healthier individual, bright future. Once again I am repeating, and stronger communities. Means they can take their own decision, even about the health or even about the life. Life is a bigger term. And there is a life university also in Croatia. They have kept the name of that university, Life University. And even the Ayurvedic system of the Indus Valley, which not only deals with the medicines, diseases, but life sciences. Next. So you can another see that community connections, stress, which is a psychological problem, then improve mental health, boost physical health. So all the dimensions, mental, physical, social, are covered by the community connection. A good connection, a smooth flow of ideas, smooth flow of the decisions, smooth flow of the knowledge. We learn next, please. This picture I have already explained to you that the voluntary groups, voluntary works, faith-based organizations, and even the community centers, they are important to organize, mobilize, and to generate the health. Health is not generated in hospitals. Health is generated in communities. So you can generate just like a tree, just like a plant. The health can also grow from community, and certain communities are very healthy and certain communities are not healthy because of certain habits or other things. Next, please. These are the few important human skills. I will say these are not behaviors but direct skills. One is be kind and compassionate. For doctors it is important. Volunteer your time. Time is not purchasable commodity. Everybody has 24 hours, whether it's a professor, whether it's a psychologist, whether it's anything. And then engage in community events, support local business, so on and so forth. Next week. Healing through connections. Three important: mentorship, not your teacher. I am basically a mentor dealing with different concepts, different ideas, and bringing you back to you, and you will further take this message to the community, so on, so forth, support group, and share the experience. Dr. Ambreen might have its own experience, Guru might have its own experience, Fatima might have its own experience, and when you share it, it blends in a beautiful experience, positive experience, good experience. Even ISRA University is nothing but an experience. Suppose you are for 2 months, you will go back with certain concepts in the mind, certain good things you might have observed in the university, or you might have been meeting with good people sometime. And then, so mentorship is a forgotten place in our post-graduation, undergraduation, but certain universities are launching, are having a full-fledged mentorship program, or there you will guide at individual level, group level, and continuously you are in touch with your mentee. We call it mentor, mentor, and mentee. Mentee means student. Next. This is important. Future is children. And if community will not invest, how they can invest? Civic engagement, economic growth, crime rate, health outcomes. When I say health outcomes, reduce the burden of the diseases, infectious, non-infectious, accidents, so on and so forth, or even nutritional. We have a lot of nutritional problems in the children, adulteration, and so on and so forth, crime. Few children are even in the hands of the dacoits since many years, and even the APS school incident in which children were killed, and so on and so forth. There are many examples. Even in Gaza, the children are the more sufferer, mothers are the more sufferer. Yes, next. What you can do? What is the way forward? There are 4 important relationships. When I say relationship, this is connection which is desirable for health and social well-being and social progress. Volunteer your time, stand advocate for change. And why I am using these words, advocate? Advocate means on behalf of the community. You bring their views in a professional way. The matter is same. The client is not professional. He comes to you and advocate takes the matter to a forum in a professional way or in a better way according to the rules, according to the regulations, according to the curriculum, or according to the pattern of the examination. Next. This is an event where actually you should participate, and you can see that a person is coming from Canada. So knowledge has no boundaries. Community has no boundaries. Health has no boundaries. So I hope this lecture will give you some kind of concept that community is not just a group of people, but it is a source, it is a way of healing, way of good health, physical, mental, as well as social health, and it is cheap, and it is manageable, it is practical. So I hope you will learn something from this. Have you learned something or not? Sure? Just pleasing me as normal students they are doing. And another lecture I am thankful to Dr. Elizabeth Marker, that she actually took this lead at the TED Talk and social media, and I will urge you, please go back, listen this lady, and you will understand better than me that community is medicine. Thank you.